sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the How to Stay Healthy show. We have an action-packed program tonight, and we're going to talk a lot about what's in the news right now, medical marijuana. So without further ado, I want to get right into it so we get everything covered tonight. With us tonight is Dr. John Baker. He's an orthopedic surgeon and sports medicine specialist, but also he's one of just a few medical marijuana physicians right here in Palm Beach County. So, Dr. Baker, welcome to the program.
Thank you.
Thank you for coming back. We had you last month, but talked a lot about orthopedic surgery and sports medicine, but I wanted to talk about medical marijuana because, boy, it's in the news more than ever this week.
It is.
And I want to kind of release the stigma a little bit about it. Now, I went on the Florida Department of Health website today, and there's a little bit about compassionate care there. And I actually went through all the doctors. I found your name there, and there weren't that many in Palm Beach County. It was just a few. So thank you for bringing this to Palm Beach County, and tell us a little bit about how you got involved with medical marijuana and a little bit about the process.
Well, I see a lot of sports injuries in my practice, and I have a lot of people also, I do some auto work, and workman's comp, and I'll see patients that have neck and back pain with spasms and chronic pain, and they're on pain pills. Still, there's like the indications for the medical marijuana still doesn't really come into that area, but there is a lot of indications for that, and we've had some patients that we've been able to help with their pain, and they've came off the pain pills, they've came off of different things. So and every month it seems like, or every week, they put one more thing on there they'll add. They just added sleep apnea, for example. So, sleep apnea is on there. There's certain indications for that. But we got into it basically because I saw people with chronic, neck and back pain, or had surgery, had things go on, and they were still in a lot of pain and discomfort. And I was getting very good results with the medical marijuana once we were able to get our process going with my company.
So you mentioned sleep apnea, and I kind of was a little surprised about that because that's not one of the ailments I thought of right away. Of course, I thought of maybe someone who has upset stomach problems or a lot of pain, like you said. But now people can see you for any variety of ailments and come into your clinic to talk to you about the possibility of getting a medical marijuana card?
Yes, I've seen some people that have cancer. Obviously, for the medical marijuana, it's really just of a qualification thing for that, if they qualify for the state. We're not really doing, from my standpoint, we do an exam in the office. We'll see the patient. We do all their medical records. We'll look into what they're coming in for. Mm-hmm. And if they qualify for that, then obviously we can help them with that. I work closely with the other doctors, the primary care doctors. For example, if the cancer patient needs the medical marijuana, we'll work with the oncologist to make sure that we're all on the same page, because I don't want them to stop their care just because they're on that. So we do still stay in touch with what's going on, and a lot of times it's the primary cares or some of the other doctors that are like, listen, this may be good for you. You have cancer, Crohn's disease, sleep apnea, irritable bowel syndrome. There's a lot of different things that are on there. It's just rather they qualify for what the state so far has let us do.
And that's a question I wanted to ask you about how other doctors felt. And in the green room, we were talking briefly. I know you can't say too much about the actual case, but there's someone who comes to see you who has breast cancer.
Yes.
And you actually got a call from the oncologist and said, I'm all right with this. This is okay, because if it's going to help my patient with their quality of life and feeling better, as the oncologist, I'm all for it.
Well, yes, and obviously I'm an orthopedic surgeon, so I'm not an oncologist. So
yeah,
for the standpoint of what we can prescribe for, if we're going to do the marijuana, medical marijuana for the patients, we should be able to have an idea of what's going on with everything. But obviously, as an orthopedic surgeon, this is just one part of my practice, but we do want to be, up with what's going on. And yes, the daughter actually of the patient called the oncologist before she ever came to see me to make sure that they would not stop her treatment. She's still on medications for that. So we're going to see how she does on it. She has nausea, vomiting. She's having some issues with pain still. And, obviously, if we can get them on to something that's going to help with the nausea and vomiting, help with the appetite, that's one of the biggest things is, we know that marijuana will cause you to have an appetite. So if these cancer patients and some of these other patients that are not able to eat right or are not eating well, this is one of the things we've seen with the effects of that. And that's one of the stigmas with that. It's not a marijuana where it's like it gives you a big euphoria or whatever. It really just takes your body and helps you get back into doing things. It helps with the spasms. It helps with your bowels. It helps with different things like that. It helps you have an appetite and want to eat. And that's the biggest effects we've had on this. And then also a lot of times it really does help a lot with pain and spasms and things like that. It's just the indications are still coming in, and we have to be careful how we prescribe it.
I was going to say, people with pain of any age, that can really affect your quality of life. If you have something that can kind of alleviate that pain or kind of mask it so you can go out for a walk, so you can go out and experience time with your family or friends without having nagging pain, I think who wouldn't be for that? So let's talk a little bit about the process, though, because I think everyone is got questions probably on how this works. So you're a licensed medical marijuana physician. When did you get involved and what did you have to do to get, sanctioned by the Florida Department of Health?
Yes. So It's a process for us. We have to take a test. We have to qualify for the test. And then once we take the exam, once you pass that exam, you're put on a list. And then once it was actually legalized, we were able to get on board with that, and then they pick the certain people that they're going to have do that. There's a lot of people who have taken the test, and there's more and more people coming into that, and the doctors, there's more and more doctors signing up for it because there's just a huge amount of people that are looking into this, especially with only having one pharmacy really open right now. There's another one that's supposed to be open up pretty soon, but supposedly, if you look at the state, for every 100,000 people that would need a prescription, there's a certain amount of pharmacies that should be available for that. And that's why they're looking at these licenses and what they're going to do over the next month or two to see if they're going to start giving more and more licenses to be able to open up more and more pharmacies. Because it's a very expensive process to do that.
And I've driven by both of them. One's in Lake Worth, and I want to say one's over in Boynton Beach.
Yeah, the one in Boynton Beach, I don't know if that's open yet.
Yeah, it doesn't look...
There's one in Miami that's open, and there's one in Lake Worth that's open that's called Knox.
Okay, I've
and
heard
that's
that
the one that a lot of my patients have gone to so far.
Okay.
And the process for that is basically just getting their card from the state, and we can go through that however you want to do that.
Yeah, I wanted to explain a little bit about that. So, you have clinics to see patients about medical marijuana in both Delray Beach and Boca Raton?
That's correct.
Okay, and now, so someone makes an appointment at one of those clinics. You see them, is it like a regular doctor's appointment? How does that work?
It's like a consultation, and we ask them to bring their medical records. We ask them to bring any studies they have, anything like that, because we want to make sure that we document all those things for them. And obviously, when we're prescribing something like this, we want to make sure that we have everything, we cross our, dot our I's and cross our T's to make sure that we're in that same field. The consultation, basically, they'll call the number. So we have a number for that, and we'll give that to you a little bit later. They'll get that phone call. If they don't get the number right away, or they'll call them back, and they'll set up an appointment to see for the consultation. That's the key first step. So that consultation is the key first step, and it's cash. It's either cash or credit, and it's $150. I kind of went in between what some people were charging. Some people charge up to $300 for a consult. Some people charge right around $150 to $200. So the consult's $150. The state requires that they have to have the consult with me, and it's a cash basis. Once the consult's been done with that, they pay that consult. That's really what they have to do in the beginning stages. They see me. We go through their medical records. We look over their qualifications. We give them a sheet to show them what needs to be done and how they would go through the process of being able to get the next step. After the consultation, then we would move on to, if they qualify, we give them a form, we give them a number, they go on their email, the state will email them, they have to go off that email, and basically they're going to be given a thing that they have to look for a card. Once they get that card from the state, they'll pay $75 for that card, and that card stays good. as long as they stay active, and they have to follow up and make sure that they're able to, the medicine's working for them, number one, and number two, that they have to keep with the doctor. That's the one thing that the state is really strict on, is they have to follow up. Some people think they can just get the card and they're going to move on. They can't do that. They have to come back in. And plus, obviously, if we're going to put them on a dose of medication, we want to make sure it's working for them, because I usually start them out at a lower dose, and then I'll move them up if we need to, based on their weight and how they're doing with the medication.
And maybe they see you in maybe a quarterly, kind of like a regular kind of doctor visit.
Yes.
Every 4 months.
Usually what I've done is I've done it like I usually like to see them within about 4 to 6 weeks after they've got their medication.
Okay.
All right, because it takes a little bit of time for the state. The state's a little bit behind right now. They're opening up more and more spots and trying to get more and more people to help, because there's so much demand for this. But there is an area where up in Tallahassee where they're really trying to make sure that they're getting the cards out. A lot of my patients that I've been writing for a little over 3 months now, a lot of my patients the first, second month have got their cards already, and about half my patients have already got their medicine coming to them.
Okay. And I'll give out that number a few times. It's 561-706-9189.
Yes.
And you can see Dr. Baker in either Delray Beach or Boca Raton. In Boca Raton, where we are, that's where our studio is, 9033 Glades Road, Suite B, Boca Raton. And in Delray Beach, 190 Congress Park Drive, Suite 160 in Delray Beach. And I'll give that information out again. You can always email Dr. Baker and his staff at ccam.medical@gmail.com. And like I said, I'll give out that info a couple times. And we're also on Facebook Live, so if you ever want to look back at this show, there's a few different ways you can do it. You can go on Facebook.com, type in All County Healthcare, INC, period, into the taskbar, and you can see all the shows there, or you can go on their website, allcountyhealthcare.com, and see all the radio shows, and you just click on the one with Dr. Baker. It'll be at the top. So thank you for All County Healthcare for sponsoring this show. Dr. Baker, let's get back into the process. So now, do you offer, does insurance cover this type of care at all?
No, they don't cover this type of care, but so you could be seen on your regular health insurance. If you had any concerns or questions before you did a consultation, you could be seen on health insurance to say you come in and see. And if we think you qualify, then we would have you come in under the CCAM clinic. We call it CCAM Clinic for Compassionate Care, Alternative Medicine. But you could see us just to see if you would qualify, if you would want to do that on your regular insurance, and we have no problem seeing you. But for the clinic itself, if you're coming in for a consult, it's not covered by insurance right now.
We just got a question on Facebook Live. See, this is really cool. What about chronic migraines? Can they come and see you?
They could come and see us for that. One of the things that's worked very well for the chronic migraines, it's not so much in this that doesn't really qualify yet. I think there's going to be some more and more things that do come in to that play, but Botox has good results with the things, and a lot of people now with the Botox, if you look at a lot of clinics out there, they've got much cheaper on that, and we've had very, very good results with Botox. In my Delray office next to me, there is a clinic there that does. We'll do that for the migraine headaches, and they'll inject for that, and it helps with that with the Botox. But it's not qualified for this yet, but I think it's going to be coming.
Yeah, I was going to say, if they've already approved it for sleep apnea, I think maybe they should approve it for chronic migraines, but we'll let them do
Especially thinking about it, okay? If somebody's having chronic migraines, what do?
Yeah.
What options do they have? They're going to go to the urgent care or the emergency room. They're going to probably be on their medications, but if they rebound from those medications, they're looking to get in shots of Demerol or morphine or, pain meds. And again, I mean, that's the whole goal. Not the whole goal, but that's one of our biggest goals, is to try to get these people off of the pain meds, the Percocets, the Vicodins that are for the chronic pain, because that's the biggest thing that we're seeing.
And I want to get into that on the other side on the How to Stay Healthy show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
How to stay healthy. It's a question asked by many people and answered by few. On How to Stay Healthy with David DePino, I'm going to bring you the latest in health news by interviewing top doctors from South Florida and around the world. Tune in on Fridays at 5:30 p.m. right here on WWNN Radio 95.3 FM and 1470 AM, the Health and Wealth Network, to hear the latest health treatments. And my curveball question of the hobbies and passions in life doctors pursue when not providing medicine. And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. Florida and beyond, and we're back with Dr. John Baker. He's an orthopedic surgeon, but he also has two clinics in Delray Beach and Boca Raton. They're called Compassionate Care and Alternative Medicine, or CCAM clinics. And you got a great brochure here. It's worth it just stopping by his office, take a look at this, doctor. There's so many things, so much information here. And I just saw veteran discount programs are available.
Yes, I'm a veteran. So.
Oh yeah, yes, that's right. Yes. You are Commander. U.S. Navy.
Enlisted. Yes, I was enlisted and an officer, both sides. So.
Okay, well, thank you for your service.
Thank you.
I mean, that is so important, and I really respect veterans as well as law enforcement. Anyone who puts their lives at risk for our freedoms is just awesome in my book. So let's get a little bit into what you're alluding before. So the opioid epidemic, which we've seen here right here in our community in Palm Beach County, how can treating ailments with medical marijuana maybe kind of help with this opioid epidemic?
Well, a lot of the times with the thing, they've really exhausted everything. A lot of times you'll see patients that have had chronic back pain or neck pain. They've had surgeries, they've had multiple things, and they still just aren't right. You know, they're still getting some spasms back there. They're still getting some things. One of the things that it's on the list is muscle spasm. It's kind of in the gray zone still. They haven't really come out with that exactly how to do that. So you have to kind of document the muscle spasms along with the rest of their history. But it's helped a lot in my patients. I have a couple of my patients that have already come back in and basically turned in their medication. They're like, I don't need it anymore. And they said it's the best I've felt in a long time. Getting off the oxys, to not have to get up every morning and live on them, or live on the pain pills. And yes, it's a huge problem down here. We've had so many people that were, getting them on the streets. We had people that were snorting them. We had people that were doing all kinds of crazy stuff with them. And then you had people that have chronic pain that come to Florida basically to be in the sunshine, to be down in the Florida state, to enjoy their life, to get out and walk, to play tennis, maybe, swim, boat, do whatever they want to do. And they just can't do it without taking their pain meds. They're on these. And we had a lot of pain management clinics and pain, docs that were, feeding patients, all these oxys, and it's just not the way to go. I mean, you don't want to mask the problem. We want to try to help with the problem, and this stuff really does help. It really kind of gets everything to relax. It kind of gets the patient to feel a little bit, less pain, and they're doing very well on it. The ones like I have so far that've been on the medication have been like, this is the best I've felt in a long time. For anxiety, because they're anxious, they're anxious, they have anxiety, they have a lot of different other things. This just really relaxes them. It takes away their anxiety. One of my patients is weaning from Xanax right now. Been on Xanax for 20 years. So it's just, it's a thing where they're able to start doing that. Obviously on these medications you have to be careful because you don't just want to come off them, but there's a way to try to wean from them, and do that. And I've had, some of my patients with the pain problems that are basically don't have that issue anymore. So.
I believe you're right on with this. I worked as a chef for many years. I actually lost 5 friends that I worked with to opioid abuse. And I can tell you firsthand, I don't have a medical background, but what those opioid pills do to the brain receptors, it's like there's really no turning back once people get addicted. Unfortunately,
it's hard to come off of it.
Yeah, and then if you can't get it, there's a lot of, unfortunately, heroin on our streets in South Florida, so that's the next thing people turn to. Now, this is an alternative, and like you said, it's something that is giving it in doses to the body. It's something that a physician monitors, so this is not something that you're going to be given to smoke to get high. This is something that's going to help you with your pain or your medical conditions. What are the two ways that are available right now to actually take the medical marijuana?
So in Florida, you can do it sublingual, where you do drops underneath your tongue, or you can do what we call vape. It's a vape tube. You put the liquid form in there, and then you would vape it, and it comes in different dosing patterns. And then at the pharmacy, when they go there, there's all different kind of strains of different marijuana. And there's pages and pages of that. That's very, very interesting. Like, we found this type of marijuana is best for muscle spasm anxiety. This marijuana is best for cancer. The strongest one out there is what they really are giving right now with the THC in it for cancer. And the patients' appetite's better. They're doing better with that. They're eating. Their pain's down. Their levels are better, and they're actually recovering and doing pretty well with that. So, and again, the other thing too is, you look at a lot of the kids out there that end up going on to pass that. A lot of them smoke pot. We have a lot of kids out there that smoke pot, and they're vaping it now. They're doing a lot of different things. They're doing it for a little bit of euphoria, but if you really ask them, a lot of these kids are anxious. They have ADHD, there's school, anxiety, all that. A lot of these people are smoking the pot out there on the streets, which we don't know what's in that stuff. It can have heroin laced, it can have all these bad things in there, and there's a lot of stuff that they're getting, and a lot of them are getting it from Colorado, they're getting it from California, and you don't know really what you're getting. And so that's the other concern, too, with that. A lot of these kids are smoking stuff, and we have no idea what they're really smoking. And we have people dying from that.
That's another great point. There's that horrible story with fentanyl. The young boy who found fentanyl in Miami, and he's 10 years old, and they think he picked it up off the street, and he died the next day, unfortunately. And I have heard that in the news that people are putting fentanyl and stuff on marijuana, and like you said, who knows who's spraying it, if it comes from the streets or that maybe that dealer around the corner or whatever.
Right.
Now you have a sanctioned pharmacy that grows it, and which is prescribed by a sanctioned clinic by the Florida Department of Health. That seems to be a much better path. So I'm really hoping that this continues moving forward, and like I said, more ailments are put onto the program, because we got that chronic migraine question come in as well. Now, I wanted to ask you a little bit about, because it was in the news today, your opinion on what the Attorney General has said about decriminalizing of marijuana. Do you think this will ever get to the point where the federal government will be concerned about medical marijuana, or is that kind of a whole different ball game?
I think what's going to happen, because there's going to be more and more states that are going to jump on the bandwagon once they see what this stuff can really do for people, because there's still a lot of doctors out there that don't always think, they don't see it on that aspect. They think it could be, it's kind of, they don't know. And doctors, for the best part, which is good for a lot of us, is that we will wait to see what happens. Not a lot of people jump on like bandwagons. We're like, when we have a pill that will come out, for example, for like, let's take Prevacid, for example. You see all these lawsuits against Prevacid and Prodosec. We will watch those medications for a long time, wait for them to be FDA approved and all that. So doctors really are the last people a lot of times to jump on a bandwagon for something. But as we see more and more people do well with this, and they're able to function in life and not be on oxys or perks or whatever medicine, or going to the streets to take the medicines, I think you're going to see a lot more of this. You're going to see the rehabs in Florida, which are huge. Every rehab here is like loaded with a lot of kids that are coming from New York and everywhere to do that. I think you're going to see this is going to be more and more of a thing where these people are going to be able to function in life and not have to be on that, because a lot of these, what are they doing? They're escaping life. They're escaping reality. Well, what will this do? It'll mellow them out enough to take away that anxiety to get them to be able to do things. Like I was saying before, a lot of kids that are in college, they function very well, and they're doing great, but a lot of them smoke pot. Because they're anxious, or they have ADHD, or they have a lot of things that, when I was growing up, I don't remember a lot of those, medical terms. We probably all had it, but I mean, I just remember like the kids going around the corner and they'd smoke their pot over in their corner, and you have the jocks in their corner and whatever else. But they were good, and they didn't have a problem with that. So I think that you're going to see more and more of that. I think that eventually the government is going to eventually do that, because the states are kind of scared. I mean, we're worried about what do we do when we get these people to come in. If we put the money in the bank, what do we do with that? Just like Colorado, there's a lot of people out there are afraid to put their money in the bank because they're all federally regulated.
So I wanted to ask you also, and I will, but let me give out the info again. While everyone's listening, 561. So this is Dr. John Baker here, orthopedic surgeon, compassionate care and alternative medicine. The number of his office is 561-706-9189. You have two offices, one in Boca Raton, 9033 Glades Road, Suite B, and one in Delray Beach, 190 Congress Avenue. I keep on saying Congress Avenue. It's 190 Congress Park Drive, Suite 160 in Delray Beach. Email is ccam.medical@gmail.com. Again, the number's 561-706-9189. Dr. Baker, I can't thank you enough for coming back on the program and telling us a lot about this timely subject. I mean, I really think this can help out a lot of people. So you're always welcome on the How to Stay Healthy show.
Thank you. I appreciate that. And again, if they want one of these brochures, this will tell them a lot about what's going on in the state of Florida. We really put this together to really show them what we're doing with that. And then obviously follow us on Facebook. Any questions or whatever, we can get back to them and answer them. Everybody has a lot of questions about it, so it's a good thing.
There's also info from the state in here. Go grab the brochure, give them a call, 561-706-9189. Thank you.
Thank you.
For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.
The opinions expressed on the preceding sponsored program were strictly those of its host, guests, and